The moment when people want cold medicines the most, when their heads are stuffed, aching, and dizzy, is exactly the worst time to try and decipher what to buy from the rows of cold medicine boxes with small print. Instead of grabbing the first thing you remember from last night's commercial and ending up unsatisfied or with side effects, I want you all to use my recommendations on how to navigate the cold and flu aisle at the drugstore. The first thing is that no matter whatever you're taking, make sure you put all of them side by side and make sure that the ingredients don't overlap. The amount of drugs in combination that you can buy at the drugstore could rival a fast food restaurant menu, so it's easy to get confused when choosing. However, most of the over-the-counter cold medicines have exactly the same active ingredients. And because they're trying to confuse you so you can buy many different products, they're very similar and only vary by one ingredient from one to the next, and you may be unintentionally overdosing with the same compound. Diphenhydramine is the same medicine as Benadryl. Most people don't realize that. Phenylephrine and chlorpheniramine are decongestants. Dextromethorphan is a cough suppressant. And guaifenesin is an expectorant which actually clears chest congestion. Tylenol and Motrin are pain reliever and fever reducers. A recent published study shows that approximately 98% of all of the products on the cold aisle are combinations of only the medicines I just mentioned, which means that you just need to pick up one that addresses your symptoms and just move on. Not only can mixing cold medicines cause problems, but overdoing it with medication can rarely be strategic or prevent other symptoms from emerging. Treat just the symptoms you have. Basically, I'm saying if you're not having a lot of congestion, there's really no need for a combo medicine with a decongestant in it. Okay, now let's look at cough. When it comes to cough suppressants or expectorants, it matters if the cough is wet and croupy or dry and wheezy. Cough is a reaction that gets secretions out. It's sometimes actually a good thing. If you're coughing up a lot of phlegm, it's better to allow yourself to cough it up. For a wet cough, don't bother with suppressants unless you're physically hurting yourself because of the cough. People have actually been known to break ribs when they cough. It turns out wet coughs might not need expectorants either. There's some evidence to suggest that expectorants like guaifenesin, also known as Mucinex, are not always that helpful. Lab studies show an effect, but in an actual person with a cough, just keeping yourself hydrated with a lot of water would help just as well. Luckily, when it comes to the youngest members of the family, the advice gets much simpler. Just say no to cough and cold medicines. We've seen advertisements for these medicines for so long, and the ads used to use things like pediatrician recommended, but the American Academy of Pediatrics has said that these medicines don't work. As of now, over-the-counter cough medicines have not been found effective in children younger than 12 and are flat-out contraindicated for children younger than 2. But that doesn't mean parents should abandon all medicines marketed to children, even when children are suffering from colds. We have very good medicines available for discomfort. One of the biggest complications of cough and cold is discomfort. You know, that feeling of being achy all over. For that, parents can use the children's version of Tylenol or Motrin. These are two very helpful medicines to reduce a child's fever. Look, colds just happen, so just deal with them. The most important thing parents should realize is that kids on average will get about 8 colds a year. So if the parent is getting all worked up about this, the kid is going to pick up on that. It's really just about supportive care and reassurance, and I believe the same thing works for adults. The key that helps you through all of this is being patient in the drugstore to decipher the drug choices that I mentioned, and being patient because you know the cold is only temporary. But please, just listen to this. There is no known proven cure for a cold because colds are caused by viruses. Antibiotics do not work on colds, so quit asking for them. I would caution anybody into thinking that any medicine is really going to help you out a lot when you have a cold. Nothing is as good as rest, fluids, and just giving your body a chance to recover. Remember, it's your immune system versus the cold virus, and you can win with these very important tips. Always keep it healthy with your favorite doctor, Dr. Corey Hebert for BlackHealthTV.com.